When it comes to substance detox versus withdrawal, what makes all the difference is having the right treatment from caring professionals. You can get that care at Gateway Foundation. I spoke with the president of their Community Services Division, Jim Scarpace, on how they make sure their patients overcome their addiction safely.
We've been offering detox at our Springfield location for quite a while, and we've recently added it to Chicago and our Lake Villa locations as well.
All right, now what's the difference between detox and withdrawal?
I think that's a good question, first and foremost. When someone makes a decision to stop using substances, one of the most challenging issues is managing the withdrawal symptoms that come from the substances leaving your body, and really those symptoms affect both your thinking as well as physical symptoms such as nausea, anxiety. You could even have hallucinations or tremors. So the detox program is really a safe place where someone can go to manage those withdrawal symptoms, allowing our medical team of professionals to provide both medication as well as our therapists to manage any emotional distress or co-occurring mental health disorders that may come with those withdrawal symptoms.
Is this an inpatient treatment, or is this something you can do on an outpatient basis?
Typically, you're with us inpatient for about 3 to 5 days, and then from there we help you get set up with a plan to either continue in our residential programs or outpatient programs based on your needs and individual recovery plan.
Now, are there specific symptoms that people have to watch out for when they're detoxing?
Yes, I think one of the most important things to know is it can be very dangerous to detox from substances, whether it be alcohol, opiates, or other substances, on your own. So you really want to be in a place where medical professionals can observe you, provide support to you and assistance, provide the right medications, not only to help you with the withdrawal process, but also to make it more comfortable, because without that, it can be really hard to not return to using.
Because you probably get very frustrated and feel like, oh, this is very uncomfortable. Let me get back into a position where I at least feel some sense of security, you know?
And then it makes it really hard to develop a plan for recovery and a plan for healing. So at Gateway Foundation, one of the things we know is it can be challenging, and we understand. And we're there to help and provide the support you need. And our detox programs are really just one step in a continuum of recovery planning that we would work with you on.
Yes, and it's one of those things that you're going to need support. So you shouldn't really try to convince yourself that you could do it on your own.
Yes, and it can feel overwhelming, and your family and friends may not understand, but we do. We've been doing this for over 55 years, and expanding our detox programs is really part of our commitment to providing an effective continuum of services so that patients can develop recovery plans and really start to heal.
Now, the detox, is it only for drugs, or is it also for, I think you mentioned alcohol as well?
So really any substance that will impact you in terms of withdrawal symptoms. That includes alcohol, that includes opiates, that includes benzodiazepines. It can include other substances as well. The first step is just really recognizing that you're wanting to stop using or reducing your use, and that second step is reaching out for help. Yes,
and actually come to Gateway as simple as a phone call. Can you walk through the door? What's the best way for them to reach you?
That's a great question. We have a 24-hour call center, 877-505-4673 or 877-505-HOPE. You can call that number anytime, even if you just want to get information. We also have a website, gatewayfoundation.org, that can provide you more information, not only about our detox programs, but our whole continuum of services.
You can also reach out if you're in a medical facility already, correct?
Yes, and actually that's a great time to reach out, because as you start to develop a plan for yourself as you're discharging from that medical facility, we can help with that.
And also a loved one can also reach out to you to find out the best way to get someone in for help?
Or if a loved one even has questions about, I'm not sure what the next step is, we can help with that as well.
If you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. Their number is there on your screen, or you can find them online at gatewayfoundation.org.